In Geneva today, delegates signed what's being called a historic pandemic treaty. The question is, could this actually put an end to future vaccine wars?
It's May 20th, 2025. The World Health Organization just approved its first pandemic treaty after 3 years of negotiations. Let's break down what this really means.
This agreement is the first legally binding framework focused on pandemic prevention, preparation, and response. Think back to COVID-19. Remember how access to vaccines wasn't equal across countries. This treaty is set up to tackle that issue directly.
Right, but how exactly does it address the problem? The centerpiece is called the Pathogen Access and Benefit Sharing System, PABS. Countries need to share samples and data with pharmaceutical companies, and in return, those companies have to guarantee access to the vaccines and treatments they develop. So does this mean wealthier countries can't just stockpile again?
That's the intention. The treaty includes a requirement: 20% of real-time production, meaning vaccines, treatments, diagnostics, must be made available to WHO during a pandemic. The goal is rapid, fair distribution, especially for low-income countries.
But how would that actually work? During COVID, we saw delays and countries blocking exports. The treaty tries to address this with a global supply chain and logistics network. This system is supposed to move health products quickly, wherever they're needed.
There's also a new funding mechanism. All countries contribute to a shared fund for pandemic readiness and response. The idea is to have resources available at all times, not just in the middle of a crisis.
But enforcement. What happens if a country refuses to share data or blocks exports? Is there any real consequence?
The treaty sets up international oversight. There will be regular compliance reviews by WHO. But there's a limitation. Nothing in the agreement gives WHO the power to force governments to act. So it's really a balance between national sovereignty and international cooperation.
Why not give WHO more authority? Was there resistance from member countries?
Yes, that's exactly why. Many countries wanted to keep control over their own laws and policies. The treaty is built to encourage collaboration, not to impose mandates. Otherwise, it probably wouldn't have been approved at all.
Are the lessons from COVID-19 actually built into this treaty?
They are. Delays in sharing data, vaccine nationalism, supply chain breakdowns. Those failures directly influence this agreement. The PABS system and the commitment to share 20% of supplies both respond to those problems.
Is that it? Or are there more steps before this becomes law?
There's still more to do. At least 60 countries have to ratify the treaty before it takes effect. Some governments are concerned about sovereignty, others about funding. Plus, details of the PABS system are still being negotiated, with a deadline of 1 year to finalize.
So, if enough countries don't ratify, does the whole agreement collapse?
If too few sign on, it can't go into force. And even after ratification, the real impact depends on how countries put it into practice. Still, just getting this far is a significant diplomatic step.
Why does it matter so much? For people listening, what's really at stake?
COVID-19 made clear how costly inequality and slow responses can be. Millions of lives lost. This treaty is an effort to fix those weak points. It's also a test. Can countries come together and respond as one to global threats?
And if it actually works, could this change how every future pandemic is managed?
That's the hope. The real measure will be the next outbreak. Will countries share data and supplies, or go back to putting themselves first? It's something we'll only see over time.
So today's treaty signing could be a turning point, but the process is far from finished. We'll be watching to see how countries follow through and whether the world is better prepared for the next threat.
Thank you for listening. Geneva made history today, but the real challenge begins now.
Thank you for joining us. This episode was brought to you by mynews.studio. Try it now for free.